From Baywatch to red carpet events, Pamela Anderson has been turning heads for decades. Oh, and she recently went makeup-free for Fashion Week. But is it all just Mother Nature's gift or a touch of surgical magic? Let's explore the transformative journey of the stunning Pamela Anderson. In 1984, at the age of 17, what I see is that Pamela has a strong bone structure, both in the mid-face and the lower face. She also has full lips. In 1988, at the age of 21, I wanted to point out Pamela's infrabrow fullness, her supratarsal show, and her great nasal proportions. Notice that the attention goes straight to her eyes, and this is despite a slight nasal tip bulbosity. She also has complete upper tooth show on smile. In 1989, at the age of 22, what I see is that Pamela has a short philtrum. She also has a feminine nasolabial angle. In women, the average nasolabial angle is 95 to 105 degrees. In 1990, at the age of 23, you can see that Pamela has thin eyebrows. And we mentioned her in our eyebrow shaving video in that Pamela actually helped bring back the thin eyebrows in the 1990s. In 1992, at the age of 25, you can tell that Pamela has a relatively high hairline. When you look at her horizontal thirds, the top third is taller than the middle and the lower thirds of her face. In 1993, at the age of 26, we can see that Pamela has an M-shaped hairline. She has those thin brows which give a lifted type of appearance. And this for some people is an alternative to getting a brow lift. By making the eyebrow thinner and positioning it exactly where you want it, you can sometimes avoid a surgical procedure like a brow lift. But the downside is that as you overpluck or wax the eyebrows, sometimes the hair will not grow back. And one thought I had when looking at these images is that it's possible that Pamela may have had a lip lift around this time. To me, her philtrum appears shorter. There's increased central arching to her upper lip. And while some people think that lip lift surgery is a relatively new procedure, it's actually not. It was invented in the 1970s, and it has been performed, especially in Hollywood, since that time. In 1996, at the age of 29, when I compare back to Pamela at age 21, it looks like she may have had some lip filler. Remember that hyaluronic acid-based fillers like Juvederm or Restylane were only popularized around 2003 to 2006, so around this time, in the mid to late 90s, it's possible that she may have had silicone injections into her lips. Microdroplets of silicone are a more permanent solution compared to hyaluronic acid filler. However, there is of course still risk of migration and lump formation that sometimes occurs many years later, and there is no dissolving agent for silicone. The only way to remove it is to do essentially a lip reduction procedure. And to me, around this time, the right side of her upper lip appears slightly higher than her left, and this is possibly related to the upper lip lift. When doing a lip lift surgery, you have to be very careful not to create extra facial asymmetry. Most people start off with baseline facial asymmetry anyway, such as at the base of their nose or at the upper lip vermilion. So when doing the actual surgery, you need to be sure that you're adjusting for that asymmetry, especially in the central area around the cupid's bow, and that you're not creating additional asymmetry. In 2002, at the age of 35, what I see is that Pamela's nasolabial folds are becoming more pronounced, and this is the case for most people as they enter their mid-30s. The cheek complex starts to essentially medialize and come down as we age. And that's what gives the nasolabial folds a more pronounced appearance. In 2003, at the age of 36, this is around the time when cosmetic Botox was FDA approved. But I see no signs of its use here on Pamela's face. For example, the forehead wrinkles are still very much visible. You can tell that Pamela has an excellent skincare routine, and we've created several products that can help improve people's skin. To find out more about those, head to feelconfident.com. In 2007, Pamela is now entering her 40s, and you can see the early signs of mild infrabrow hollowing as the facial fat is starting to diminish. The face is essentially coming in and down. As the ligaments weaken, the fat starts to atrophy and gravity is taking hold. And as we look at her lower jaw, there are some signs of mild jowling. As the cheek comes down and in, it gets essentially stuck at the mandibular ligament, and right in that area is where that jowling occurs, and that's what gives it the appearance that it has. In 2011, at the age of 44, I'm seeing some signs of cheek and jawline filler. To me, Pamela's face appears fuller both in the mid-face area, around the cheeks, and in the jawline area. Sometimes filler can be used along the jawline to mask the effects of jowling by injecting directly into the pre-jowl area, in effect giving the jawline a smoother appearance. In 2014, at the age of 47, I am seeing some signs of a potential brow lift procedure, but of course it's difficult to tell because of the frequent eyebrow shape changes and because of the changes in the thickness of the eyebrows over time. But to me, the eyes do appear more open, and the brows overall do look like they're positioned at a higher point. In 2017, at the age of 50, I am seeing some signs of a potential facelift and fat transfer. When you look at the tragal area, it does appear like it's been flattened and that it's quite broad, and that's what often happens as a facelift is done and the tissue is repositioned. Usually you have to then remove some excess skin, and as that tissue that was actually much more medial gets repositioned back over the tragal area, it becomes this sort of almost like a pancake type of shape, and it looks different than the original tragus. Also, to me, her jawline contour is much smoother than it was in previous years. And that jawline contour is reestablished as a facelift is done and the neck comes up with the lower face. Remember that a deep plane facelift addresses the mid face, and that's the difference between a deep plane approach and a more mini lift or a smaz only type of approach. And sometimes, in addition to a facelift, a fat transfer can be performed to increase the overall fullness of the face in areas that may have atrophied over time. In 2020, at the age of 53, I think that Pamela may have started Botox around that time, to the usual areas, the forehead, the glabella, the crow's feet. You can just see a much smoother contour to her upper face. In 2022, at the age of 55, the face again looks a bit fuller, and I wanted to go back to the discussion about fat transfer. And as you transfer fat from an area that's most commonly used, say the abdomen, to the face, the fat cells retain the memory of where they came from. So if you have abdominal fat cells in your face, if someone were to gain weight, most of us gain weight first around the midsection, abdomen, and as that happens, that fat actually now gets bigger in the face. So people who've had fat transfer, some of the early signs of weight gain can then be seen in the face before they might even experience it in other parts of their body. The total cost of these potential facial procedures is $175,000. While the world has watched and speculated about Pamela's beauty evolution, there's no denying the authenticity and courage behind her recent choices. In a world obsessed with perfection, Pamela's makeup-free debut at Fashion Week and her raw, candid video for Vogue remind us all of the true essence of beauty, embracing and celebrating oneself, flaws and all. Here's to Pamela for reminding us that bravery isn't just about defying norms. It's about being unapologetically true to who we are.